any bills today. Today is just for information only, so quorum is not really necessary. Sarah, if you want to come on to the table. As everyone knows, child care is one of the most pressing issues that we're going to face this session. And we've been through meeting after meeting trying to come up with solutions to this problem. And I think the stark reality is the only solution available is spending money to ensure that child care centers stay open with the loss of federal funding, and to ensure that we set a stage for growth in child care facilities within the Commonwealth, and that we use all means available to provide early childhood education to our kids. And the purpose of today's meeting, we're going to hear from Dr. Vanover, and just to kind of give everyone an update and kind of cover some information on what's happening in other states as a result of the funding. And then we'll close out with Secretary Friedlander and talk about funding that's available through the cabinet, what funding is restricted, what funding we might have available to appropriate. I think within the legislature, the governor's call for universal public pre-K, just in all frankness, I just don't think it's going to happen. I don't think there's the support within the legislature, and I don't think that's the right model to follow. I don't think the state has the capability to do that. When you look at our schools and the infrastructure that would have to be built, all kinds of issues that I just don't feel like are really a viable option, not to mention that it would destroy child care if we did that, based simply on the fact that preschool that's the only age group that child care centers generate any revenue. Babies and toddlers usually lose money. I always say at our center that our babies are going to have to get a second job because they just don't make any money. So that's kind of where we are today in the purpose of today's meeting, and we will we'll finish this up by 10. And we kind of limited the presentations today just to kind of be very specific, and hopefully we can start setting a course and kind of narrowing down the funding needs that we're going to need. I know there's different recommendations on different amounts, and it's really hard to get the data that's needed to really pin down what we need per child. So hopefully the Secretary and Sarah will address that this morning. Sarah, I'll give you the floor. Please introduce yourself for the record, and you may begin, and thank you for being here.
I'm Dr. Sarah Vanover. I represent Kentucky Youth Advocates. I'm Policy and Research Director specializing in early childhood education policy. For those of you who are not familiar with Kentucky Youth Advocates, we are an independent think tank that specifically focuses on positive outcomes for children and families throughout the state. Early childhood education is one of the areas that we focus on, but we also look at health, family supports, juvenile justice, education, K through 12, as well as a focus on the birth through 5 sector. So just to give some background on Kentucky right now, at this point, we have 1,776 licensed centers, and that can be a freestanding building, not in a home, that cares for 4 or more children. We have 209 family child care homes, and that's a home that is watching more than 3 children that are unrelated to the caregiver, and they can watch up to 6 children that are not related to them. With this current capacity, we can serve 163,866 children, which, based on Kentucky's need, is a lot. It's a much smaller number than we actually need to serve all of the working families who need child care from birth through after-school programs. Our children that are currently receiving child care assistance through the state, which is for working families that are working at least 20 hours a week and need support, or families who the caregivers are full-time students and working towards a career. We're serving 34,367 children in that program right now. There are a lot of issues with the child care system, and I've heard all of you speak about it at one point in time, so I know that you know that this is a field with a great deal of need. One of the biggest issues that we think about with the child care field are our child care providers. The workforce in many of our human services fields right now is a huge concern, and child care providers are in significant shortage right now. The biggest reason for that is wages. In Kentucky, the average wage for a child care provider is $12.39 an hour, meaning that we have a large portion of child care providers that are making close to the minimum wage. We see providers that are leaving the field to go towards retail jobs where they're stocking shelves, hospitality jobs where they're baristas. I can tell you that when you talk to young children at the age of 10 or 12, they don't tell you, when I grow up, I want to stock shelves. That you hear kids say things like, when I grow up, I want to work with children. When I grow up, I want to be a teacher. But the problem is when they get to this role and they want to be a teacher with young children, they cannot support their families on the wage that they're making, because an annual salary of $25,700 a year is not enough for them to continue to work in the field. The Annie E. Casey Foundation told us this year that 98% of jobs pay more than child care providers, and that included dog walkers. Many careers pay higher than our child care providers. And many of our child care providers in Kentucky do not have any type of paid benefits, predominantly medical insurance, but many of them also do not have paid time off even. So they go to work even when they're sick because they're worried that if they miss one day of work, they won't be able to maintain their bills. As we think about this presentation and the information that I want to give you, I've heard many of you speak on KET after the State of the Commonwealth address on infrastructure that we need to put in place in Kentucky: clean drinking water, transportation systems, making sure that we continue cleanup in eastern and western Kentucky after devastating storms and disasters. Childcare is just as much a part of our infrastructure as these industries, because without it, families cannot go to work, and working families cannot provide for themselves, and the community suffers as a whole. So we need to think of childcare as a part of our infrastructure and why that's so important to keep in place. During the past several years, Kentucky has made great improvements in the child care program, and honestly, we've gotten national attention for many of the programs that have been implemented. Prior to the pandemic, Kentucky reimbursed the child care assistance program up to 40% of the reimbursement rate. That means that we pay, for children who are on the child care assistance program, we paid the full cost of care for 40% of the child care programs in the state. And many of those programs were meeting the minimum standards because that's all that they could afford. During the pandemic, when we had extra funding, we were able to increase that to families being eligible to enter the child care program at 85% of the state median income, and reimbursing at the 85th percentile, where the majority of the programs in the state would be covered by the child care assistance program without the family having to pay an overage that they might not have available. We've also been able to pay child care providers based on enrollment and not attendance. Now, I want you to think about this, because in the public school system, if a child is sick for a week, they have the flu, we don't dock the SEEK funds. The teachers still have to come to school. The administrators are still there. Our nutrition staff are still in the kitchen. But in child care programs in the past, we have not paid when children were not in attendance, even though all the expenses, the facility, the mortgage didn't change. During the pandemic, we were able to pay based on enrollment and not attendance, and that had a huge impact on the child care industry. Another amazing implementation that happened during the past several years is free childcare for childcare providers. I'm so proud of Kentucky in this program, and I can tell you that over 38 other states have reached out to us for information. I've spoken to 4 other state legislatures about this, given them information. We're already seeing other states copy our regulations on this. This program is set up so that if you are working at least 20 hours a week in a child care program, that you are eligible for CCAP for your child. Now, thinking about the fact that most of our child care providers are making $12.39 an hour, a lot of them were already eligible. But sometimes a spouse or a partner or another caregiver who lives in the home makes that family ineligible. And right now, we need to attract child care providers to the field. If I can make $15 an hour starting off at Target, or I can make $10 an hour starting off at a child care program, as a working parent, there may not be a choice that I have to make. Obviously, $15 an hour is going to support my family. But if I'm making $15 an hour and I have to pay for 2 children in child care, then working in the child care center where I can be with my children during the day, where I can go on the pumpkin patch field trip with my children and be there with them, but I can also serve other children of working families in Kentucky. We've seen increases and retention in our child care provider workforce because of this implementation. And many other states have looked at Kentucky and said, why haven't we been doing this all along? If you ask owners and directors of child care programs, they'll tell you that their workforce has improved due to this policy that the cabinet has implemented. Other things that have been implemented in the past several years that have had an impact have been startup grants for centers in child care deserts, which is areas that do not provide the needed amount of child care for the working families that do need it. Startup grants for family child care homes. And family child care homes tend to be much more successful in rural areas than centers since families are spaced so far apart. It's very hard to get a center in rural Appalachia to get 40 families when they all have to drive, but a small home that's close to 3 or 4 families can be much more successful. Many family child care providers that would like to offer this service have a hard time with those initial fees, setting up their home in a way that is safe for the children, getting the materials they need, and those startup grants have been very successful. Another program that we didn't implement recently, it started back in 1998, but we have added to it, is our scholarship program for child care providers. So that we can help educate our providers when they come in entry level in the workforce. We can give them an education on how to care for young children properly. We know that a lot of our child welfare numbers, when we see children that have not been treated respectfully and carefully, come from parents or caregivers who don't understand a child's developmental expectations. They expect too much of a child and then become frustrated when they don't live up to those expectations. Educating child care providers on child development and helping them have the skill set that they need keeps them in the field longer. And honestly, right now we're competing with McDonald's and Burger King, who are offering scholarships for the people that work in their field, and they can go to college while they work at fast food restaurants. And this program has given them the opportunity to get child development certificates, associate's degrees, bachelor's degrees, and even master's degrees for our administration, who may need some of that guidance in order to run a facility. These are all great things that you all have approved, that the cabinet has implemented, and they have helped our field so much in the past 3 to 4 years. Again, the income exclusion for child care providers, if we're looking at return on investment, if you want to see what the product is, an infant room has 1 adult that can watch 5 children. Like Senator Carroll said, the babies need a second job. They are not bringing in the money. A preschool room can have 1 adult watching 14 children. So if you average those numbers, you think that 1 child care provider is caring for 8 other children of working parents. So for every child care provider that we bring into the field, there's an 8-child return. Currently, we have 3,572 child care providers that are taking advantage of this free child care income exclusion for working in the field. And that means they are caring for 28,576 children of other working families. We are retaining them and drawing them into the field because we're helping to support them, even though they might be making an extremely low wage and they might not be getting the health insurance that they need. Right now, out of 120 counties in the state of Kentucky, 79 are considered child care deserts. And even within larger communities like Jefferson County and Fayette County that aren't considered deserts, there are large portions of the communities that might be a desert within that. If you look at portions of Louisville, there are areas where child care providers have not been successful at opening and staying open. So families in that area don't have access. Again, family child care homes have been seen to be one of the greatest ways throughout the U.S. to increase capacity for the state, because they have more flexible hours a lot of time. When we think about families that don't work between 7 a.m. and 6 p.m., family child care homes usually have the ability to be more flexible, to help parents who work 12-hour shifts, to help parents who might need overnight care or particularly weekend care. And we see this a lot in manufacturing, hospital work, retail work, because most child care programs typically work 6 a.m. to 7 a.m., open in that range, and then close by 6. Our after-school programs for school-age children typically work 2:45 to 6 p.m. When we engage our family child care programs, we have more flexible hours, and those can be a huge support in our more rural areas that need these supports. One of the biggest reasons that we see capacity limited throughout the state is zoning laws, and they have a great impact on our family child care homes because they might limit any type of business being opened in a residential area. However, a family child care home is not a storefront business. This is a home that's watching a very small amount of children and offering them a home-like setting. And we want to find ways within the state of Kentucky that we can make zoning laws more friendly, create child care friendly communities, and also make zoning fees that aren't cost prohibitive to family child care homes that may have a very slim margin. Within the state of Kentucky, we have zoning fee ranges for child care family homes that range from $25 that range to over $500. And if you're a family child care provider that might have $300 profit at the end of the year, a $500 zoning fee can be very cost prohibitive. I've had a lot of questions on the stabilization payments that were issued throughout the pandemic. Kentucky did offer 9 stabilization payments. They were spaced out to help child care programs, and then the cabinet offered an additional one in December. Initially, those stabilization payments were used to get programs back on their feet after they had had limited capacity, after they had debt buildup when centers were closed. But one of the biggest things that they did was allow for centers to offer wage increases to be competitive, because everything else inflated. And so child care providers had to think about wage increases as well. With stabilization payments ending, most centers are back up to full capacity if they have staffing. But what we're seeing is that there's a hard cap on what you can charge a parent. This is not a supply and demand field where you sell a bunch of things, you realize it's popular, you sell more. There's a cap on how many children can be in a center, and there's a cap on how many people one adult can watch. There's also a cap on how much you can charge a parent before they drop out of the workforce. And so child care programs can increase their wages, but they don't have a lot of flexibility there. The stabilization payments were helping them with wage increases. So as those stabilization payments go away, wage increases are in jeopardy, and staff members are now choosing whether they're going to stay in the industry again or whether they're going to leave. Now, Kentucky, one of the things that we did that was fabulous that helped is that our stabilization payments were spaced out all the way to the end of the time period that we could give them. And then the cabinet gave the extra payment and gave us the 3 extra months. There were other states that pushed a lot of that money up front, and so they've been without stabilizations for several months. But so they're ahead of us in the game, but what we're seeing is they're already having large numbers of centers close without additional support in some way, whether it's stabilization payments or whether it's other options. They're ahead of us. I contacted a friend in North Carolina about a month ago. She has the equivalent job to Andrea Day for the Division of Child Care, and I asked her how things were going. And that week, she said 7 centers were closing because North Carolina is several months ahead of us after they gave their money out earlier. And so we're going to see the same trends that we did in similar states that they're experiencing now. We're months behind them, but it is going to occur. One of the questions that I get often is the financial structure of a child care program. I will say that as a past center director, I don't have a business degree, and I never did. And many of our child care programs don't. However, this is the list of expenses. This is everything right here on this slide. Your expenses include wages for staff, which is 50 to 80% of your income based on how much your facility costs. It depends on whether or not you have a mortgage or whether or not you own your building, but facility costs, rent, mortgage, utilities, and insurance is also a big portion. Food, if you serve food, that's also a portion, but it's very hard to reduce the cost of that. You can go to Kroger, or you can go to a larger company like Gordon Food, U.S. Foods, Gordon Food. Maybe you get a small discount if you order in bulk, but it's still a very small percentage. Consumables, you have cleaning supplies, you've got construction paper, things that you have to buy, but it's a very small portion of your income. Professional training, and then if a center offers transportation, they have to pay for their 15-passenger van, things like that. Operational expenses are all about salaries because basically it's human capital. That's the retail item that child care is offering, is time with those teachers. And so all of the money goes towards that. Things that we have to think about again, why this business is unique. There's a maximum number of children. Kentucky has not the most flattering adult-to-child ratios. In the state of Kentucky, 1 adult may be left alone with 10 2-year-olds. There's only one other state in the U.S. that has a worse ratio. on 2-year-olds. And let me tell you, I have been the one adult in a room with 10 2-year-olds, and it's a job that you all do not want to have. That means that the maximum of that classroom is 2 adults with 20 2-year-olds. Again, it's not a setting that you want to be in. We have maxed out those numbers. And if you have a wait list of 15 people that all want to get their 2-year-olds in, you still can't put more than 22-year-olds in there, because what we see when we increase ratios of adults to children is more injuries, more near deaths, and more deaths. Those are numbers that we have to post on our state website. And Kentucky's been lucky, because most of the deaths that have occurred in the past 10 to 15 years have been in unregulated childcare. But if we try and change those numbers for capacity's sake, we see injuries and death, and we see a lack of safety. So we have a hard cap on how many children we can put in a facility. So the other option is to increase the cost. Right now throughout Kentucky, we see a lot of numbers around $250 a week, $1,000 a month. That's hard on a family. I have an 11 and a 13-year-old right now, but when my kids were an infant and a 2-year-old, I paid $18,000 in childcare that year, and that was a decade ago. Our parents now have experienced significant inflation, and the past 2 years of inflation has been the largest that we've seen in multiple decades. If you're a working family and you're only bringing home, if one caregiver, one parent is only bringing $200 home at the end of the month after childcare, then they have to make a hard decision. Is it worth it? I don't get to see my child during the day. Would it be easier to stay at home with them? Or wait, now I'm only working so that I can get health insurance, because I need health insurance for my family. And if I put all of the health insurance on my partner, my spouse, then they wouldn't bring home any money either. So there are hard decisions that are being made, but if we continue to raise that cost for families, then we will lose more families in the workforce, and it will have the largest impact on working mothers. Right now, we stand to lose up to 40% of the female workforce if we don't have childcare that can support working mothers in the economy. The other thing we have to think about, that 1 to 10 number for 2-year-olds, high quality programs don't run at that number, because you know that you will lose staff. No staff member wants to be the one adult with 10 2-year-olds. So high quality programs voluntarily cut their funding and operate at a 1 to 6 ratio or a 1 to 8 ratio, but they are losing income to do that. They voluntarily say, I'm giving up that $1,000 a month for that child, for those 2 children, for those 3 children, because I want children to be safe and get a quality education, and I want my staff members to be happy and stay. And so those high quality programs make even less budget than what they could. What does a tuition include? A lot of times people relate it to babysitting fees. If I pay somebody $10 an hour to babysit my child, then it should equal this. One child's tuition does not cover one adult. In one classroom during the course of the day, if you're open 12 hours in a center, you probably have 4 to 4.5 adults working in that room, because you have 2 full-time employees that start the day, you have the employees that have to finish the day. They overlap during lunch breaks, because in a 12-hour day, you don't want one provider staying the whole 12 hours. The quality of care and the work on that person would be incredible. We need lunch breaks for providers. We need people that come in and give 15-minute breaks during the day to meet federal law requirements. So we've got 3 to 5 teachers in a classroom. We have wages that go towards administration and nutrition employees. We have facility costs, food costs, consumable training. So now when you look at that $250 a week number, it doesn't seem enough. It's not actually the cost of what it takes to run a child care program. We're saying this is what we can charge parents, but it's not covering the cost of everything that we need it to. So what are the options for child care providers if they're not getting enough money from the tuition? So they can reduce wages for the child care providers now that a lot of the federal funding is going away. They can say, I used to start everybody at $10 an hour, but now starting employees are going to make $9 an hour. They can increase tuition for families and say, I'm going to charge you $300 a week. We've already seen centers on the line between Louisville and Indiana that have jumped their tuition, almost doubled it, up to $424 a week for an infant. They could do both, and a lot of centers are going to have to do both. They can reduce wages and increase tuition. Another option is dropping infant and toddler care. We have centers in Kentucky that start with 2-year-olds and go up through after school care because the cost of infant and toddler care is so expensive. However, working families cannot go back to work after the birth of a baby if there is not infant toddler care in their communities. And then the other option is closing their doors permanently and having even less child care than what we do now. Based on our child care providers' options, Kentucky has to do something. So we have options to consider as well. We can increase the number of child care providers in Kentucky. Okay, so I'm going to talk about some of the options that we could do for that. We can increase subsidy for child care programs, not for families, but for programs, and figure out how to subsidize the programs so that they can be more financially viable. We can increase child care subsidy for families based on the cost of care and support caregivers in the workforce. Right now, we reimburse the child care assistance program based on the market rate. So that is what people in the community can charge. And that's less in Eastern and Western Kentucky because of the cost of living in those communities, even though the cost of care is not less. So you may only be able to charge $165 in a rural community versus $250 in Lexington or Fayette County, but it does not cost $165 in a rural community. It really costs the same. And there's also the option of universal preschool in a mixed delivery format where child care programs partner with the public school system to offer care. So child care wages. In order to increase wages and keep people in the field, we have the option of stabilization payments. But we have other options as well. We have wage supplement programs. And that would be programs in states like North Carolina, Arkansas, Tennessee, where they're finding ways to, the state supplements the wages, and they know that the money they're putting into the child care centers goes to wages and not just to playground mulch or other ideas like that. You can increase the overall child care subsidy program because those funds, although they're for parents, they go directly to the centers. And when they get more money for subsidy, then they're able to increase wages. And we can also continue the CCAP income exclusion for child care providers as a benefit to our providers. So I said several states. We have lots of states looking at wage supplement programs. What they do is they look at, particularly like in North Carolina, which has a very similar makeup to our child care system, supplements are offered to the centers for their child care providers who stay at the same center for 6-month increments. They also factor in the education level of the providers and encourage providers to increase their education level. With these programs, their state systems send the wage supplements. It goes to the center, which passes it on to the provider. It is a wage, so it is taxed income. But it's shown to have increased retention because the providers know that if they stay longer in the setting, that they're likely to get those bonuses. And it's also increased education levels of staff because they want to continue to get those larger bonuses based on their education levels. So they pursue their education, they have higher training in order to care for children, and they get larger wages, which encourages them to want to participate in the child care workforce. We have seen lots of states have positive examples for this. Kentucky has looked at a program called Wages. It's WAGE $sign for the S. But there are also state systems, that's kind of a name brand program, but there are also states who have created their own wage supplement programs. You may ask why you would want to supplement childcare when there's lots of industries that need higher wages. But again, I want to refer you back to that 98% of other industries make more than childcare providers. Our teachers are underpaid. Our nurses are underpaid. There are a lot of professions that need more wages, but childcare providers are barely paying their bills. And finding a way to pay them more will retain them more. So again, increasing funding that goes to the childcare programs will benefit wages, and it'll also benefit the survival of the programs, potentially allowing more programs to start. This includes startup funding for new child care programs, predominantly family child care homes, but also programs in desert areas. Increasing reimbursement rates for the child care assistance program or maintaining the ones that we increased over the pandemic go directly to child care centers, even though they're assisting the families as well. One big thing that Kentucky has not done that the federal government is going to consider requiring in the future is reimbursement rate based on the cost of care and not the market rate. And that would benefit the centers a great deal. Again, continuing to pay on enrollment, not capacity, and partnerships with the public school system. And then with families, allowing more families to access CCAP, keeping eligibility open, and capping copays so that the copay is not cost prohibitive. Universal pre-K is a great option for our kids to have 4-year-old care. It is a long-term goal. And right now the priority is maintaining child care and not waiting for child care to collapse. Offering care to all 4-year-old children, though, does have things we have to consider, like the impact on the child care sector and partnerships, finding ways that we can partner with private child care so that we can make sure those centers don't collapse and we keep 0 to 3 care open. Programs that they rely on the 3 and 4-year-olds to make tuition, because watching children from birth to 2 loses money. You start to make money once you have a 1 to 12 ratio, 1 to 14 ratio. If you separate those things out and you only have infant toddler care by itself, it could collapse. But having programs that partner with the public school system and get some direct funds, particularly special education funds, into our private child care sector could allow for opportunities in the future as a long-term goal that we build. If we went that route, we have to consider space, facility costs, where we would house these children, and a long-term plan to expand, as well as a set amount per child. And so those are things that we have to consider, kind of like SEEK funds, but a preschool amount, because we wouldn't have partnerships if the child care programs would lose money housing some of our 4-year-olds. So consider that. Right now, our top priorities are those programs that were implemented during the pandemic and sustaining them. Making sure the child care assistance program meets increased need for families, continuing the CCAP income exclusion for child care providers so that we get the workforce we need, maintaining the employee child care assistance partnership and helping to expand that in its first year. It's on its feet, but we need to let more businesses know about that and explain to them that employers can benefit from having consistent employee attendance and having quality child care for the children of the employees. Maintaining startup grants and continuing scholarships. Those are at the top of our list to maintain. I'm happy to take questions.
Have any questions? Senator Meredith.
Thank you, Mr. Chair. And first, I want to commend you for starting off our 2024 session with this presentation. Dr. Vanover, you've done a great job, and certainly this matter has our attention, and I think we'll try our best to come up with some resolution, but I think we have to understand that this is not going to be a 1-year, 2-year proposition, that we have to build this infrastructure that you're talking about, and I appreciate that. You mentioned our current capacity is 164,000. Do you have a percentage as to what that is of the total need?
Well, our counties look at 3 different groups to determine whether or not you're a desert. You're not a desert if you have 1 spot for every 3 children, because we know that there are children who stay with family members that have a parent that stays at home. So we need 1 child care spot for every 3 children. We have counties that only have 1 spot for every 7 children. We have counties that only have 1 spot for every 10 children. So a lot of it comes down to the county level and the availability there. But I would say that we probably need at least half, like a 50% increase, maybe more, to serve all the families that we need. Now, some families are in unregulated care, and that's typically where we see more accidents and, unfortunately, deaths of children. We need to give those unregulated centers resources to be available and have families know that they have regulated care options in order to reduce that.
So about 250,000 children in total is what our need is. And
that's a rough estimate because I can't go out and count all the kids.
I won't hold you to it, but I just want people to understand that this is a tremendous need that we have going forward. Mm-hmm. What's your opinion on what has occurred with House Bill 499, the partnership that Representative Heverin passed a couple of sessions ago with work with private employers to help provide some subsidy for child care?
I think that the bill is fabulous, but I think having the word pilot in the first year made a lot of employers nervous to enter it, saying if I enter this, if I pay money, and then the first year it goes away, then that can be also a little scary to change all your policies and then the funding go away after 1 year. The other thing that I've noticed, I've gone out to multiple chambers and talked about it. I've been at lots of different places. The Kentucky Chamber of Commerce has gone with me, Metro United Way. Every time I'm in a room talking about it, most of the businesses there don't know about it. We need to find a way to spread the word about that community. Maybe it's technical assistance. I know the chamber wanted to do a lot, but they can only reach so many people, and they have tried. They've put out Charles All and I are on a federal committee of other states that are looking at this program, and we've used some of the money that the Bipartisan Policy Center in DC gave us to help with promotional materials, but we're just not getting to every small business that this would benefit. So finding a way to get some technical assistance to tell more people about it, and for employers to understand that it could be around more than just a year, would increase participation a great deal.
Thank you for that. I appreciate that. And I don't think that our Commonwealth in itself can solve this problem. We've got to have a strong partnership with the business community, and I appreciate your very candid assessment of that very greatly. That's very good. I also appreciate you mentioning about the cost of living for rural communities. I think the cost of living, urban versus rural division, is one of the greatest hoaxes perpetrated in the American public. It doesn't cost less to live in a rural community, and we need to keep that center as we move forward with reimbursement for urban and rural centers. But again, thank you for your presentation. Ms. Chair, thank you for bringing this to our attention.
Thank you, Chairman Meredith. I think we're going to go ahead and move forward. We're going to be short on time. Secretary Freelander, you want to come forward, please, sir? Sarah, thank you so much. Always appreciate your expertise, and I think it's important for know that we're not looking for answers with the child care issue. I think Sarah and the cabinet, with the programs that we have put in place, those are answers. And it's just the funding that's needed to keep those programs going. And we are setting the standard throughout this Commonwealth or throughout this country. And I've seen firsthand how these programs are working. And you all have heard me say this before. My center, we have been fully staffed 2 or 3 different times in the last few months. One comes and goes. The quality of staff that we're getting is better. We are paying a good wage. We're going to keep paying that wage. But just to put it in perspective, we have about 110 kids within our child care facility, and I just finished our quarterly financials, September, October, and November. You take away the federal dollars, we lost $12,000. So if you pay your staff a good wage, pay them benefits, that's what happens. You lose money. And we own our building, so we have all the other overhead, and we're part of the food program, but we lose money. And that's the business side of it that Sarah spoke about, and that's just one example. Secretary, please introduce yourself for the record, and you have the floor, sir.
Thank you very much. Secretary Eric Friedlander with the Cabinet for Health and Family Services. Thank you for the opportunity to present today. I would be remiss if I didn't say thank you to Dr. Vanover. Her service to the Commonwealth, a lot of the positive things that you saw that she presented, she had a hand in doing. And so I just want to say thank you. She's been a great leader for the cabinet, with the cabinet, at KYA, and I would just be remiss without saying that. And her presentation was fantastic. It identified the very specific issues within childcare. And I'm going to take just a little more preamble. I think we've talked a lot about this, even at the Human Services Task Force. We identified childcare as probably one of the bigger pieces of the benefits cliff. It is. When you lose childcare, you heard some $1,000 a month. If you're fortunate, it's a tremendous burden on families. It's a tremendous burden. We don't have enough capacity. All those things are absolutely true. There is no question about that. I think we all share that. I think we all saw how important, hopefully, what childcare means to employment, what childcare means to local economies, the impacts of childcare deserts in rural areas. These are all things that I think are absolutely valid. And Chairman Carroll, as you said, there is no magic bullet. I'm at the Cabinet for Health and Family Services. We have a lot of no magic bullets, unfortunately, but we can make progress. And I know we can make progress, particularly when we work together. I think we've demonstrated that a bunch of times, and I hope we get to demonstrate that here. We don't always agree, but we always try to work together. And I, again, appreciate that greatly. So you had asked about some of the federal funds. Most of this, you see the discretionary piece under ARPA, that's the one that really isn't at this point fully expended. That'll end kind of towards the end of 24. And with that, we'll be able to keep some of the things that Dr. Vanover pointed out, some of the pieces around copay and some of the things around allowing folks who work in childcare to continue to do that and have that income exclusion for CCAP. There are several things that can probably get us through this calendar year, and we'll continue to do that. And acknowledging the importance of those stabilization payments. Being honest, we knew we had to get childcare here. We knew we had to get childcare in shape, not closing like North Carolina, right? And you heard all the places that were closing in North Carolina, and I appreciate some of the programs that are in North Carolina, but you also then heard a lot of places are closing in North Carolina. We had to get them here. We had to get them to the point where we could get to a budget session and have the discussion on how to continue to support childcare. If we had ended before, we'd already see, as Sarah testified, we would already see places closing in a loss of capacity. It was not an easy thing to do, but it was something we had to do. And so most of these places, CARES money, we've done a really excellent job of spending the money that we received from the federal government to make sure that we could support our child care providers. We're not at the point where we were in 2019 in terms of number of centers, but the last couple of years we've really have stabilized. And that was the point of the stabilization payments. And I think it has been effective. It challenged us to try some new things. Some of the things that Dr. Vanover talked about, some of the pieces around particularly providing some stipends for folks to open family care homes, working with some of the other folks like employers and universities to perhaps give them some stipends so that they could take that initial cost of opening. That has been there have been far fewer of those. We've worked with adult day centers to try to do some combination adult and child. The first one is either opening or has just opened, so really excited about that. But these are all around the edges. And as we've talked about, some of the challenges are, and again, you heard Dr. Vanover address this, complete agreement. There is, and it has been for years. I talk to you all, and I tell you all the time. I go back to when the Glaciers first left the state. I remember when we did Kids Now, right? When we came up with the STARS rating program, and the tension has always been between cost of childcare and quality. Dr. Vanover addressed that too, and it's true. And we at CHFS and the Governor's Office of Early Childhood Development, just true statement, doesn't matter what administration. There's always a tension about how do we make sure we have the capacity and the quality at the same time. Yes, that is true. And it's always a delicate dance. And I would, that's been my experience the entire time I've been here and talking about childcare. I used to write regulations for the Inspector General's office, and I think I wrote some early, at that point they were called daycare, and it's hard for me sometimes because that's what I want to say, because that's my old language. It comes out. So lots of federal funds. What would we need to do, right? Just if we would continue to do what we've done during the last couple of years with the additional federal funds. This is about the number because I put the stabilization payments in, and that's a big number. It's a big number, and it has kept places open. Again, no question about it. And again, some of those things underneath, we can probably keep going with the funding that we have. September, somewhere between there and the end of the year. But there's no doubt that additional funding is necessary to keep centers where they are. This number, would really be about if you're going to do the same capacity, right? You're not really picking up any capacity here. You're supporting what you have. Senator Meredith, to your point, what do we need? It's a different number, right? Here, you've seen the budget. It is in. We do have some provider reimbursement rates. We do want to put in some extra money. No question, people lose money on 0 to 3. No doubt about it. No doubt about it. So how do we bring more funds to serve that population? And then the question is, what's enough? What does quality look like, right? And of course, Chairman Carroll, I did hear your admonishment at the beginning, but as I've told you, I would be remiss without talking about this. Universal pre-K is a way to increase capacity. If you look at these numbers, they're still a little below that 3/3. They're right around that number. You gain some capacity that way. How that rolls out obviously is important, but I'm a believer in public schools, right? When I interviewed in the Fletcher administration, coming from the Health and Family Services Cabinet, that was Cabinet for Health Services then, and it's millions of names, they asked me, what's the most important thing that we can do in state government? And my answer was education. And I believe that. Still, I think at one of your task force meetings, I believe you asked me that same question. I said education and housing, right? Those education is what moves us forward. And I absolutely believe that. I had a little stint at Family Resource Centers, and the joke here is often that I've been over a lot of different things at the cabinet just because I've been, since the Glaciers left. And I know the difference it makes. It does make a difference. So I will pitch to you the universal pre-K. I always think there are a lot of benefits of folks being in schools. I think, it not only the learning environment in general, but transportation, family resource centers, some of the healthcare in schools, some nutrition services, and hopefully the things that we've been working on for years. We talk about kindergarten readiness and grant scores and things like that, and always frustrated with where we are as a state. Hopefully this would have some impact there. And with that, I realized I probably didn't obey what you were asking me to do, but I feel like I need to present that to you all. And so I appreciate the time. I appreciate the opportunity that we've had to have discussions. I think we oftentimes have good discussions. I call this on stage. But when we talk and when we work together, I know we make a difference for kids. I know we do. I know we make a difference for folks all across the Commonwealth. And I, again, appreciate the opportunity to present today, and thank you for allowing me the time.
Thank you, Mr. Secretary. Senator Rocky Adams.
Thank you, Mr. Chairman, and thank you for your presentation. I do want to follow up on your comment that their adult day centers are now in, or you're going to open one up in combination with child care centers, because, we always think about the reason that women leave the workforce is because of child care, but women are leaving the workforce because they are the primary caregivers for aging parents and different types of things that happen to their families later on. So I love that concept that we might be able to look at adult day and child care, because that's an important component for getting women back into the workforce and having that care, something reliable. But I want to follow up on your first slide, which was the investments to child care. You talked a little bit about the federal dollars that have come into Kentucky primarily for stabilization. You talked about how we might have some of those dollars left over to maintain in 24. What is left over, for lack of a better term, that we think we might be able to expend in 24 for some of these providers?
The discretionary funding.
Okay, so we've got $293 million left over.
Yeah, and what that can do is that leaves your cap reimbursement rate, some of that CCAP eligibility piece, a few of these things on here. I'm sorry. I probably should call Andrea Day up so she can like get me out of this. It's some of the apprenticeship program. It's some of the things we've been doing that have been up that were some of the slight expansions that we did. That will be able to hold again probably through September. So
Okay.
it'll get us through this fiscal year. It'll get us through this budget, so that we can figure out how to address that in the next budget.
Okay. So that's very helpful as we go in and we try to put some numbers down that we do know that there is some sort of stabilization that will occur in 24. Okay.
Yeah, should get us through this. Should get us through this fiscal year.
Okay. Thank you very much. Thank you, Mr. Chairman.
But
So-
not the stabilization payment. So that's the big piece. So the big stabilization, that 200 million on this,
Okay.
that's not that.
That's not that. Okay.
It's pretty much the things that are underneath there. That's fair, Andrea? Yeah. Okay.
So that
Yeah.
okay. So all of those that are listed underneath.
Yeah, but not the quarterly stabilization payment.
Okay. Thank you.
You're welcome.
So the discretionary funds are restricted where you cannot use for sustainability payments?
Those are, let me find it. Correct. Those are, you pretty much need to use them within childcare. Am I saying that correctly? Okay, good.
Okay.
You know, I have my Greek chorus back there. I need to have. So yes, that's correct. And there's some limitations on some of those discretionary funds, but I just know that's the, I believe, the way to move forward to get us through the fiscal year.
And so you're saying that the discretionary funds, the 293 million, that will last through this current fiscal year?
Yes.
So that would be, what is that, July?
Yes, and probably a little thereafter. There'll be a little bit left, you know, if we're projecting out, but again, not more than a couple of months. Again, am I saying that correctly? Yay. They have taught me well.
Chairman Meredith?
Thank you, Mr. Chairman. I'd like to go to your last slide. If you could.
This one?
Yes.
Okay.
You know, I think what impresses upon me is this in itself to do this, it's going to take a massive infrastructure investment. I don't think that our public school system is in a position to take this on. I think it's going to have to be in stepwise fashion. And I'm concerned, as Chairman Carroll is, about what this does to our current child care system. We've got to find some way where this is going to be a symbiotic relationship for everyone. I think this is an admirable goal, but again, it's got to be in partnership with our child care centers. So again, it's going to take a big investment, and it's going to take more study and more time, but just want to make sure we try to protect everyone.
And we've had those discussions, and I appreciate that, and I do appreciate your perspective. My concern is that unless we make an investment in this kind of way, that really our money's not going to go for any more capacity when it is what we need. But again, that's why we have these discussions and hearings.
Last, Mr. Chairman, if I could, just curious about your assessment of House Bill 499 as well. That Dr. Hunt, she did
I
a
think
good
it's
job explaining.
fantastic. I agree.
Secretary, can you turn your mic on, please?
Sorry, I think I was too far away. Going back and forth here. I think it's fantastic. It was one of my favorite bills out of that session because I like the concept of that public-private partnership. I agree. It's been we have been working with the chamber as Dr. Vanover said. She's been working as we go out and present. We try to let folks know that this exists. It's on our website. We do our social media pieces. I'm not sure why the uptake is as slow as it is. It could be that folks feel like, oh, it's a pilot and it's not going to be here. I've certainly heard that as well. But I guess, you know, again, being around forever, I know that we work in 2-year cycles, we work in budgetary cycles, so that doesn't make me any more nervous about that, because I think it is a great program. So perhaps if we continue it and we are able to demonstrate, maybe there'll be more of an uptake. That's my best supposition about why the uptake's been slow.
I think it has tremendous potential, but
I do too.
something we're going to have to work on. Appreciate that. Thank you, Mr. Chair.
Any other questions? Okay, I don't want to give any impression as far as with the public preschool. It's got to be all of the above, and I think within each region of the state, within each county, within each city, it's a different situation. And we've talked to KCO, to KLC, and the hope is that local governments will take greater ownership of this issue, and them combined with the Cabinet for Economic Development, and we'll work on these issues at a local level and set up a structure that works for them. I know there's some innovative ideas out there in different areas. Some of them involve public schools, and I think that's great. I think we're going to need all of that. But I think as we move forward, we've got to be careful that we're focusing on the supply. The demand is already there, and the demand is overwhelming. We've got to worry about the supply. And, creating programs that within the business community, I think those are great. $4.99, great idea. But if we don't have the capacity to serve these kids, it's all for nothing. And we've got to focus on that. And when you look at what we invest in education in this Commonwealth, is there any one age group that's any more important than the young kids? We know about the brain development. We know what science tells us. And just like when we look at education, it is about workforce development, and preschool, early childhood education. It's about childcare, but it's about education. It's about workforce. So the importance of this is no less, and I would argue that it's greater than what it is for primary, secondary, post-secondary. And until we start looking at early childhood education for what it is, education and part of our system, and we start funding it in that manner, we're not going to make any progress. We look at our scores and how they're declining. That starts in early childhood education. And the data clearly shows that kids that are in preschool, that are in child care facilities, they're better prepared, their scores are better when they get to school. So I hope that as we continue to look at that and we look at investments, and I know these are huge amounts that we're looking for that are going to be needed. It's an investment in education, an investment that this state's been lacking. People, we tried everything else in education, and are we really making great strides? We're not. That's the reality of it. We're not. And we've got to go deeper. We've got to start sooner, and it's in early childhood education. And I feel like that's where we need to invest. I see it every day. I see the difference in kids. I see the difference these programs have made. Sarah, Mr. Secretary, these programs work, and they were innovative, and we can get through this. And I think we have a great foundation. It's just time for the state to step up and to make the investment that we need. And I think the dividends that are going to be tremendous as the years go by if we take these steps. And I'll get off of my soapbox. Does anyone have any closing comments? Mr. Secretary, Dr. Vanover, thank you both so much for being here. Appreciate all the work that you do. And those of you who are in the crowd that have worked on this issue, thank you for all your efforts. And it's really great to see so many people involved in so many different areas. And I hope through this session, and I've beat my head up against the wall for months and months, and I know my co-chair in the House has also. It comes down to funding. Programs are in place. We've got a great start. We've just got to pay for it now. And I know everybody says that. I sound like a lobbyist now. Thank you all so much for being here. And when is our next meeting going to be next? And I'm not sure about a committee meeting next week. I think we only have one bill assigned to committee so far, but we will let you all know as soon as we can. Before everyone steps away, we have some regulations that are on the agenda, and I apologize for that. I overlooked those. Are there any questions or comments about these regulations? If not, they shall be considered reviewed by the committee, and I will entertain a motion to adjourn. We stand adjourned.